Now, joining me, Utah Republican congressman and someone who uniquely is aware of how healthcare works in this country because he is a physician, and that is Congressman Mike Kennedy. Congressman and doctor, thank you so much for being here. I want to first start with these reports that the White House is set to announce its own healthcare proposal. Have you or any of your fellow Republicans on the Hill seen those details?
CNN has a story about.
I haven't seen those details yet, Ryan, but thanks for having me on, and I'm eager to see those and work through this important issue. The reality is Obamacare has been, over the past 15 years, a disaster financially. We saw with the Schumer shutdown, $1.5 trillion demand associated with the Affordable Care Act, and it's obviously not the Affordable Care Act, it's the Unaffordable Care Act. So I'm eager, along with my Republican colleagues, including Brett Guthrie, who's the chair of Energy and Commerce Committee, which is a big part associated with healthcare debates, to analyzing what the president has to say and working that through the Congress in the way that we do in transparency in committees and in debates.
Okay, so you have made it clear that you're not a fan of the Affordable Care Act. If the president's proposal does include an extension of the ACA subsidies for maybe 2 years, but would do things like capping eligibility or provide an option for part of that tax credit to be distributed to healthcare savings accounts, is that at least the beginning of a framework that you could get behind and negotiate around?
I'm a big fan of health savings accounts. The reality is when people are in control of their own money and also in control of their own health care, then they make better decisions. I've sat in the office as a primary care doctor with people that are on high deductible plans that have HSAs that their employer contributes to, or in this case, the government would contribute to. And these people ask me if the blood tests, the stress tests associated with heart testing, they ask me questions about how much it's going to cost prior to engaging in these tests. And with them, we have a cost decision-making process. And I tell them, well, this is a test that's essential, and this is estimated how much it will cost. And this test is maybe not as essential. And bringing them into that conversation, I think, is a vital part of cost containment. It actually allows good quality health care, too, because imagine when you're interacting with your doctor and your insurance company, and you're incentivized. You get a $50 donation or contribution to your health savings account, and for doing things like mammograms or colonoscopies, which it's hard to do these preventative care things, or you get $100 HSA contribution associated with coming in for your preventative physical. That puts the patient in charge of their own health care instead of waiting for some government bureaucracy to say that this is how we should go about things. So I'm eager to actually see what kind of policies we can put into place that are going to incentivize people to not only care about their own health care and have the right sort of incentives associated with their own health care, but also the costs associated with that health care. When you have a third-party payer and the people, the doctor and the patient are disengaged from that cost process, that's why we have $1.5 trillion demand associated with the Schumer shutdown and these Obamacare subsidies, which are not, there's so much waste, fraud, and abuse associated with what's happening right now.
So I think there's a key part of what you described there, though, and that is that the folks that would take advantage of these health savings accounts would also still be a part of the deductible plan. How concerned are you that someone is given this benefit from the government to put in an HSA and then just chooses not to buy any sort of health care and therefore is not contributing to the overall risk pool? Couldn't that drive the cost of health care up even more? Should there be something to compel them to actually still have some sort of backup insurance plan?
I see those people as well, and those people actually come into my office and they're fee for service. They pay at the time of the visit. They use their health savings account. And Ryan, you and I both know through the insurance process that there are ways for us to work on that. High-risk pools, low-risk pools. These young people, many of whom have been signed up for plans, they don't even know what are in there. We estimate there's 35% of the people that are on these Obamacare subsidized plans that are actually not even accessing health care at all. It's either because they don't want to, they don't even know that they have these plans in some cases, and many of them are young and healthy. And the idea that they are the only ones that should have double and triple deductibles and premiums so that they can subsidize older and sicker folks is one of the problems associated with Obamacare. So a high-risk pool would take care of that. It's an insurance program where we would put people with higher subsidies associated with that into the high-risk pools and allow those people to receive the high-quality health care that they need associated with their ailments, while the younger and healthier individuals who may not even access health care as they're younger and in a better physical condition, that those people pay lower premiums and lower deductibles, which would reduce costs for those people.
But what you are talking about is kind of a fundamental shift in the way healthcare has been provided in this country for quite a long time. Not to say that the policy is bad or good, but right now you're up against a deadline here at the end of the year where 22 million Americans could see their premiums skyrocket. And I understand that you don't agree with the Affordable Care Act as an underlying policy program, but there needs to be a fix to this immediately, not a long-term plan. How concerned are you that what you're discussing, what the White House is discussing, is too little too late? And how do you solve this immediate problem of that huge pool of Americans that are going to see their premiums hike?
Thanks for the question, Ryan. It's an important one for you and your listeners and viewers to attend to. You said 22 million, and we estimate there's about 1 million people that are going to be subject to these possible premium increases. So the reality is 93% of the people on Obamacare subsidies will see no change or little change associated with their program. So the vast majority of people are actually going to continue to receive the Obamacare subsidies for 15 years that they've been receiving. That 7% or that I'm hearing numbers of 1.3 million people. We need to attend to those people. The lower risk people, these are high deductible plans with HSA contributions that come from the money that we may appropriate from the federal government. And the high risk individuals that may be associated with that, then we need to have a glide path to make sure waste, fraud, and abuse are rooted out. But in addition to that, that these people are still able to access the high quality health care that they need in the middle of. I've taken care of these people. Diabetics, they have a lot of needs, and they're very expensive sometimes, those needs. And I want to make sure that those people have excellent access to high quality health care, which I and people like me as doctors have been delivering for many years in the Obamacare process. So there's a way to make this happen. The last thing I'll say, Ryan, and it's disappointing to me as a preventative doctor, is Congress often doesn't do anything until they absolutely have to.
Right, yeah.
So the fact that we've got an end of the year deadline is kind of typical. It's midterms or it's final exam time for a lot of college students. I guess we're just we got 3 weeks in December. Thanks to the Schumer shutdown, we didn't have as much time as we thought we'd have. But there are many good people working on this important issue in a bipartisan fashion. I'm grateful to partner with my Democrat colleagues to find solutions for the people of America.
Well, I don't disagree with you that Congress waits until the last minute as someone who covers the place every single day. But before I let you go, sir, I just want to be very clear. You do not believe that these these enhanced subsidies need to be extended. You think that you can handle that without the extension of those subsidies?
Not without serious reform. We have people reportedly $600,000 a year that they make that are getting these premium subsidies. That is entirely inappropriate. Those people can pay full freight for whatever plans that they want. We have people that are 400% of the federal poverty level or less. Those people need help, and I'm happy to provide it.
Okay. Dr. Kennedy, Congressman Kennedy, I appreciate you being here. Have a very happy Thanksgiving, sir, and we'll see you when you get back here to Washington.
Same to you, Ryan. Thank you.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.